Good evening, everyone. I'm Abanti, Community Manager at Dr. Polaris, and your moderator for today. I hope everyone is able to hear me.
Yes, Abanti. Hi.
Thank you so much, Doctor. So, as a team, we are looking forward for being a constant part and parcel of your MBBS journey. Through our Dr. Polaris MBBS app, we come to you in the form of lecture videos, notes, live discussion, animated videos, and many more. And really, I'm so excited we are here with you in the most awaited Polaris Talk session once again. I hope we are ready to start session, and without further ado, I would like to introduce you all to Dr. Sanchit Bajpai, our Chief Academic Officer. Hi, sir. How are you?
Yeah, hi, Abanti. I'm great. How are you?
I'm very well, sir. I'm sure that everyone's waiting to hear from you about today's talk, and it is about the early clinical exposure. So I think we should straight dive into the topic, and it's on you, sir. Thank you so much.
Thanks, Abanti. So, welcome all of you. We have been following a lot of lectures about first year, how it should be, and what you should do in order to succeed in your first years. And we have always stuck to that basic philosophy that in order to be a great doctor, you have to have a keen observation, a keen sense of skill making, as well as train yourself in the right way and in the right direction. And that is what Dr. Polaris is teaching you right from the beginning, what to do, when to do, and how to do. And if you see this particular topic of today, it happens to be a lot of interest to a lot of people around. Why? Because things have changed since the time we were doctors, and now when you are a doctor, you have a lot more to do and a lot more to see. And that is where we come in. And today's topic of discussion is all about early clinical exposure. Now, what this early clinical exposure is all about, and how many hours you should devote to it, and what you should study, what you should not study, this all happens to be something cloudy in everyone's mind because nothing is clear till now. When you're becoming a doctor, you have got thousands of textbooks, you have got thousands of material to read, but by the end of the day, I don't understand why do I read that? Or exactly what should I do with so much of material? What should I do with so much of knowledge? Now, if you just see the journey of your first year till final year, you have got some odd 19 subjects to fill inside such a tiny brain. And then finally you understand, why am I doing this? Happen to pursue dermatology or maybe radiology ahead, or maybe I want to be a community expert, or maybe I want to be a surgeon. Then why am I reading everything and so many things around? Why should I know about medicine? Why should I know about pediatrics? Why should I know about basic anatomy, physiology, biochemistry, and so on? So this everything happens to run inside a young mind. And even those thoughts were inside me when I was a student. So first, let me take you to my journey. And then after that, I'll straight away click on to what is happening in today's time. When I was a doctor, that particular point of time, we never used to have this kind of a scenario as you are facing now. You have this foundation, you are being taken to clinics, you've been taken care of nicely. But when I became a doctor, I was flooded with textbooks. When I entered into med school, I had no idea as to what I'm reading and why I should I read it. There was anatomy, there was physiology, there was straight away biochemistry. I used to read everything. I passed my first year, got into second year, I read the second year subjects. Finally, my basics are finished. Then I enter into professional year, that is the third prof and fourth. And finally, when I exit out, I finally understand that when I read medicine, when I read surgery, I have to go back to my first year to actually understand the anatomy again. Because when I was reading anatomy, I didn't know that practical is going to come in fourth year. And I had no idea where that biochemistry is all linking up. Or why am I reading that glycolysis or Krebs cycle, and what sense does it make in my normal scenario? Where does my patient come into be? That was my question to myself. And that made me kind of, confused at those particular points of time where I couldn't link these facts to any of the particular disease I was seeing. Now, thanks to NMC, that after 20 long years, this has changed. And finally, when CBME came in, that is competency-based medical education, that we have been giving you some ideas about since the past webinar. But what exactly changed here? They are not in the philosophy that traditionally was being followed as just learn and learn. Now the concept is learn and see. And that is what the difference between a good doctor and a great doctor is. You have to implement what all you learn throughout your years of MBBS and then finally get to a diagnosis and treat the patient. Because finally, you have just one person whom you are treating, and you have to give that person a medicine, and you have to understand about that. Then you have to communicate to the patient. And after communication, you have to give him reassurance that you will be fine, everything will be fine. Now, cut to what is happening is till now, we didn't have any idea about what is happening after MBBS is over. Because straight away, when we entered into casualties as interns, we were clueless. As to now, I'm seeing a stroke patient, what to do? Because finally, in my neuroanatomy, I read somewhere brain. In neurophysiology, I learned about these corticospinal tract and some tract. And then finally, I have stroke in my final year as medicine. So I know what to do in medicine side, but I still don't know that which part of the brain is actually involved because I forgot about it. Because it was right way back in first year. And that is general. We all forget things. We can't keep 5.5 years of knowledge inside our brain for 10 long years, right? We have to have it instantly, and it snaps out in no point of time. That's why I call MBBS as a short-term memory loss, because whatever you read today, after 7 days, it's gone. It's clouded, right? So in early clinical exposure, what do you have? So let me start with a quote that the more you sweat in practice, the less you bleed in battle. That is what early clinical exposure is all about. You have to practice and see, so that once the battle comes, once you're in the battleground, once you're in the casualty or in the wards facing your patient, you have an idea as to what to do, how to do, when to do, and what exactly to follow, and those norms correctly, right? So there is a very particular saying from Benjamin Franklin that tell me and I'll forget, teach me and I'll learn, but involve me and I'll evolve. And that is what we are all about. We are evolving with medicine each and every day of our lives. And each and every second, something or the other is coming up. Now, CBME, what you guys are currently blessed with is that you are having an early clinical exposure so that you can see what you're reading. Now, let me take a scenario here, okay? Suppose, let me say you are reading about anatomy, and let's say you're reading the upper limb, right? Now, when you're reading the upper limb, when you open your chapter in BDC, you have got a huge page there, right? Where you have got origin, insertion, nerve supply, blood supply, action. Now, when I was a student, how I used to learn that? Let's say biceps brachii. Okay, biceps brachii. It has got two tendons, long head, short head, originates from scapula, then goes here and attaches here. But by the end of the day, next day when I used to think of biceps brachii, it was a new muscle in my head because I can't remember that. Right? That is what exactly you face. Now let me take you another scenario. Okay, fine. I think my phone is out of charging. Let me pick up my phone. Okay, I have my charger in my hand. What did I do just now? I picked up this charger so easily, but what happened? I used my brachii, my biceps brachii, my brachialis, my coracobrachialis, my brachioradialis, my flexor digitorum longus, my opponent's pollicis, right? And I just picked it up. And finally, now when I'm going to keep it, I'm using my triceps. What did I do? I just applied it. I applied to my daily learning. So I don't basically believe in any kind of exposures that have to be only in clinics. I believe that you should see medicine each and every day in each and everything around you. Find medicine in each and every object. And that is why we focus at Dr. Polaris on the same ground. We want you to see each and everything that you apply in everyday life, whatever you are doing. Suppose I'm talking to you. Why am I talking to you? How am I talking to you? Why my lips are moving? Why my coordination is coming from the brain? How my eyes are seeing this camera? Each and everything makes sense to me. Because that is something that you need to implement in your learning skill. And that is what CBME is all about. When you start learning, you'll start implementing these on your own. And that is why my professor used to say that you don't require anatomy for cheating, because you are yourself a cheat book. You're yourself sitting there, you know what is there inside your body. So this is what early clinical exposure is all about. It's not about going to the clinic and learning something. It's about exposing yourself to such surroundings, as to start thinking that way, when, why, and how this particular thing is happening. And that's what your logic should be behind any particular disease, right? Now let's come to the facts. And let me take you to what exactly you have been designed for and what is your curriculum of early clinical exposure. So early clinical exposure, as per the NMC norms, has got 3 pillars on which it stands. The first pillar that they have given is provision of clinical correlation. That means what? That means that you have got first year 3 subjects. They have given early clinical exposure to be at least 60 hours. Now, what does that mean? That 20 hours is given to anatomy, 20 hours is given to physiology, and 20 hours is given to biochemistry. That means you should learn at least 60 hours of clinically correlating these particular subjects in real life scenarios. That is what they mean, right? So how does this happen? So as I told you, they have got 3 basic elements to it, or 3 basic pillars to it. One is that there is a provision of clinical correlation, and I'm going to tell you what is clinical correlation. They'll give you certain scenarios. They'll give you certain patients in your hospital setting. They will give you certain ready-made simulation videos, or maybe they will give you a kind of a page where they have written a scenario. They will stimulate your mind somewhere as to this is something about a patient. And then you have to start thinking as to what that basic science thing fits it. So suppose you're reading about upper limb, so maybe you will get a disease related to the upper limb, such as a claw hand. And then you're finally thinking, yes, the claw hand finally happens because of this particular thing that I was reading, right? So this is about basic clinical correlation that I'll come more into, okay? Just I'm telling you a brief about it. Now, the second thing about early clinical exposure that has been implemented by CBME is human contact. Now, what has human contact got to do so early? So as I told you, when I was when I was a student of first year, when I actually entered into MBBS, I had a kind of a faint knowledge about, suppose I'm reading about, let's say, neuroanatomy. But once I see a patient of stroke, I really don't know what to say and how to actually examine, because I'm fumbled, I'm clouded inside. So your human interaction or your human contact is very, very important. You have to see the patient in order to remember it. So once you see a stroke patient, you'll always remember that how a stroke patient looks like. Because you have read once and then finally you saw that patient, so you will remember. That's how the human mind works. So finally you'll remember, yes, I saw a stroke patient, he was like this. And once I went to speak to that patient, he had a fumbled speech, he had not a very clear voice, that patient had paralysis on one side of the body. You'll remember those things. But once you read them in those tiny text boxes, you'll never remember those things because you have not seen that. You have never experienced that. So what CBME says that you need to experience those things. You need to see the patient. You need to see that human in order to experience that actually this has happened to the patient. And now the third element comes, that is humanitarian grounds, where they actually get in the EdCom model, where they concentrate upon attitude, ethics, as well as communication. That you should have the right attitude to deal with the patient. You should have ethical standards, which are very well laid by NMC norms. And then after that, you should know how to communicate to that patient and how you should talk to a patient and how you should counsel a patient. So this is what this whole idea or the 3 elements of this early clinical exposure have been designed. So as I told you, there are 60 hours that have been given to you. So 20 for each subject that you should have in order to get exposed to the clinical scenarios that actually happen in a hospital. Reading and seeing are very different. It's a huge sea. If you don't see that sea, you'll never be able to understand that maybe you are very well read, you may be very well educated, but you will never become skillful if you don't go and see that, right? So what exactly this basic correlation or clinical correlation is all about? So you will experience that, suppose you have read a particular topic of anatomy, let's say anatomy, and you're reading that topic, okay? Let's say you're reading heart, okay? And once you're reading heart, you are into the section of coronary circulation. Now you're reading coronary circulation, you're reading about coronary arteries in the heart, but you actually don't know where this will apply. So what exactly the clinical correlation will come into play is, you will be called to a classroom, or you will be sitting in a classroom, or you'll be seated inside an OPD setting. And then finally, you will be exposed to a scenario. So what that scenario can be, okay, so the scenario can be a 45-year-old Mr. Rakesh who has just recently gone to his workplace. He experiences sudden chest pain in the center of his chest, and he calls his wife. And the wife comes to the same workplace, and he sees, and she observes that Mr. Rakesh is having a very dull and pale expression. He is kind of fainting, and Mr. Rakesh is having a feeling of doom that he's going to die. He's rushed to the hospital. As soon as he's rushed to the hospital, there are a panel of investigations that follow, and they do an ECG, which shows an ST elevation, and finally, they come to a diagnosis of myocardial infarction. Now, if you see this in my sense, this is a final year question where you will study acute myocardial infarction in medicine. But how come this applied to your first year knowledge? This is what CBME clinical exposure is all about. They want you to actually correlate this scenario with the learning of anatomy and physiology that you have already done. And you are the best person to do that. Why? Because you're fresh with that knowledge. I might not be that fresh when I'm in final year, because you guys are the ones who are the most educated. That's why I call my first years as the best doctors of MBBS. Why? Because they have the best knowledge of basic professional years. Because we usually forget that by the time when final year comes. So how do you apply that? You know the anatomy of coronary artery. You know well about the physiology and pacemaker system of the heart. You know about the chambers of the heart, how they are working. Finally, you just put in that something is wrong with the coronary circulation of Mr. Rakesh, and that is why he finally ended up into an MI or a myocardial infarction. That is a clinical scenario. So you will be exposed to such scenarios, right? And this is how it will be, right? This is how you have to start thinking about you, right? And you have to start getting that concept inside your brain that why these things are happening. And you have to question when, why, and how in every clinical scenario possible, right? Abanti, can you just comment? I'm having a lot of giddiness really currently, and I'm not feeling a little well.
It's
Can you just
okay.
come in for
Yeah,
just 5
yeah.
minutes?
Yeah, it's okay, sir. That's fine. You can take some rest and
Yeah, because I'm
maybe
having a lot of
have some
nausea
cup.
and I'm having
Please
some
have
kind of
some water, sir. Please have
giddiness.
some water.
Yeah, yeah,
Yeah.
yeah. Okay. I'm fine now. Thank you very much. What happened? Now, did you see what I did? What exactly happened? I was sitting, I was talking to you. I suddenly had a kind of vomiting sensation. I was feeling very giddy. Everything was rotating around me. And when I went to have a glass of water, my hand started shaking. What is this called as? In general terms, intentional tremor. I'm having nausea. I'm having giddiness. So, what it implies to, I might be having a stroke. And that stroke might be involving my cerebellum. Now, when you read anatomy, you will read cerebellum, but you won't read stroke. You will understand about the cerebellum. In physiology, you will understand the way the cerebellum works, or why the cerebellum produces these kinds of things, or balance you will understand. Now, what exactly implies to my clinical scenario? How does that question? I am a patient who presented with giddiness because my cerebellum is not working. Once I started to do a job, I'm not having any kind of coordination. My hand started shaking. Simple. This is a clinical scenario. And that is why I told you find out answers of medicine in each and everything possible. You don't need patients to learn medicine everywhere. It implies to you as well, in general things, right? And it's as simple as that. Very, very basic things. Okay, now, as I'm talking to you, suddenly you come to my ENT clinic and you are seated there, and I have a nice 15 group of nice students sitting chit chatting, and I'm starting to teach you. And suddenly I see someone coming inside and barging inside, and he says, "Doctor, my voice is gone. I'm not feeling well." What is this? Now, a good doctor will just see the patient, he'll sit there and he will start asking questions. Okay, what happened to you, Mr. John? You don't seem well. Since when do you have that? But a great doctor will hear first. If you just hear Mr. John, you will clearly understand that something is wrong with his vocal cords. And if something is wrong with his vocal cords, that means something has to do with voice. And once his voice is bad, you know this is a hoarse voice. The next thing that I'll do, I'll try to definitely put in a camera and see. And maybe I find a tumor. And then the clinical scenario becomes a tumor scenario. So I'll give you a tumor scenario that, let's say, carcinoma of larynx is your topic of competency. And what you need to know how is voice produced, that you are taught in physiology. What is the way the voice is produced, that you're taught in anatomy of larynx. And finally, how will you treat this particular condition? You're finally understanding it in ENT. Now you saw how your first year topic became a third year topic. So this is how these clinical scenarios are. And this is what the basic knowledge is, because it has got 10,000 things written in NMC norms if you really try to understand those modules. And you will get confused. But the whole aspect to all of this, the crux is that you have to just expose yourself to tiny little things right from first year till the end of your final year in order to become a great doctor. And once you start seeing it, you'll remember it more, you'll apply it more, and you will understand it more. Now let's come to another scenario. Okay, let's say you are first years and you take something in the abdomen. You read about, let's say you are reading about gallbladder, right? And you read about the gallbladder anatomy, but you have no knowledge why that cystic duct has been given to you, why the cystic artery has been given to you. Why am I reading Callet's triangle? I don't even have an idea about it. Why am I reading the hepatobiliary tree? You just know that is there. But what will happen? You'll finally understand the role of that gallbladder when you read physiology, right? Cholesterol makes no sense to me. But cholesterol cycle has to be understood, because if high cholesterol is there, it can actually become a cholesterol stone. And that cholesterol stone can finally happen inside a gallbladder. Now, how did that gallbladder actually connect to that huge chapter of cholesterol where I can't remember even the steps? This is what clinical correlation is all about. So once you're becoming a doctor, be like Dr. House. Once he's sitting there, he knows 10,000 things that are happening inside a patient's mind. He just not focuses upon that singular domain that, okay, I'm a doctor of medicine, I will only treat medicine. No, that concept is wrong, absolutely wrong. Because you need to think about the patient's nervous system, you need to think about the digestive system, you need to think about the renal system, each and everything, right from anatomy, physiology, biochemistry, pathology, everything. And if you actually see, anatomy is something that is related to surgery. Physiology is something how we work, and you finally get the answers in medicine. Pathology is some pathology that happens to you. Pharma is something that how you treat that pathology. So almost half or 70% of your MBBS is done in the first 2 years itself. So this is why you need an early clinical exposure. And that is why that early word came, because it was never early for us. It was very late for us when we finally understood why we are reading all this, right? So try to find out medicine in each and every object. That's the crux of the story. And that is what I'm trying to implement here. So you will have these kind of clinical scenarios that will run in your hospital setting, and they are different in different hospitals. There are no strict norms to it. So 20 hours has been devoted to one subject, but you might find that in your particular college, you have a different module that is running. Some hospitals have a different module that is running. So there's not a fixed module. So how will it go? That initially you will have a facilitator. You will be told about a clinical scenario. Let's suppose you are told about a scenario of diabetes. Okay. And you're told about that scenario. Then you will have competency related questions to that scenario, where competency related questions will be how? That you will have a question of, let's say, glucose metabolism. And where do you read that? You will read that in biochemistry. Then after that, you will be asked what happened when this glucose metabolism goes abnormal. So you will understand that abnormality of glucose metabolism can lead to what all things. One is diabetes. Then finally, you will understand, oh, I read ketone metabolism. Where did ketone come in? So ketone is when it accumulates, it causes something called as diabetic ketoacidosis. So that is a clinical scenario that you will finally learn in medicine, right? So you will be given a question about that how does ketone play a role in this particular scenario? So this is the competency that you will finally connect your first year subjects. Always understand, you're not here to know about the chapter in whole. You're not here to know about how to treat this particular condition. This early clinical exposure is just been given to you to open your minds towards a certain scenario that can happen in a real life setting. Remember that. So you're not supposed to know that how does diabetes happen in a full, and how do you treat it, and what is the dose of insulin? No, this is going to happen at the right time when you read it in medicine. But the early clinical exposure part will expose you to certain competency questions where you can relate these particular aspects in real time scenarios. That how a diabetes patient will look like. How will I approach that patient? Or what are the symptoms that he will produce? Why the symptoms will be producing? why there is something gone wrong in the glucose metabolism, how the glucose metabolism actually works, what is the counterpart that will control it, right? So this is how it will follow. And this is what the key competencies that will be given to you will be taught to you by your teacher. Now, the second question that will come into play is, after you are taught this scenario, then there is something that has been called as a reflection. Now, what is a reflection? The teacher sitting in front of you will devote 10 minutes to reflections. That means he will ask the students that, okay, I have told you a scenario, I have told you about diabetes, you have understood about glucose metabolism. Okay, now you tell me what you understood about this. So maybe he'll point out about one of the students who are there in the class, and those students will stand up and they will recite, or they will tell, just in a casual way, like I am telling you, that what did they actually understand. So this is the best. Why? Because since when I used to read in a class, I used to just listen, half of the things used to go in my mind, and then after that I used to stand up and go away from the class, and half of the things used to get washed out by the time I used to reach my mess. Because you don't have a checkpoint. Nobody, no mentor is actually checking you actually what you understood or what you didn't. But now what is there, thanks to, again, CBME, that the mentor has the right to actually test you. He will actually take this advantage of this reflections and say, okay, what did you understand? You tell me now. So he will point out, so all the students will be actually in an interactive session. And this will be kind of a bonding between the mentor and the students also, right? So this is where you will be tested. Then after that, once your reflections part is finished, then after that, there will be an assessment. And how will an assessment will be? Assessment is again arbitrary. It is upon person to person. There will be different type of assessment modes in different colleges. So some of the colleges prefer to take a viva of students. Some of the colleges prefer to take a simple MCQ based questionnaire, or they will give you a simple short SAQs, or they will create a kind of a clinical, small clinical vignette and they will give it to you. Or they will create a long answer type of an answer and they will start giving it to you. So that depends upon, again, different teachers and different modes of asking those questions. But again, the idea remains the same. The idea is to assess you, to assess what you actually learned from today's learning. So if suppose I'm sitting in front of you, so I can give you an assessment sheet as to what did you learn from the time I'm speaking since half an hour, whatever I did. So that is my assessment to you. That is how the assessment will be carried out. So again, so there'll be three things to it. You will have a facilitator who will give you competency related knowledge, and they will relate those clinical scenarios to a real-time situation. And then after that, in that particular scenario, when he's teaching you, he can show you a real patient, he can show you a video, he can show you a simulation model, he can show you any particular thing so that you actually know what is happening in those situations. Second, again, reflections, they will ask you to tell us, and finally, they will assess you through assessment. This is how a particular clinical case scenario or early clinical exposure in a hospital runs. And this will be carried out inside OPDs and in your clinical classrooms or demonstration rooms where you will be seated in your hospitals, right? So all in all, this is about early clinical exposure. Try to go back and follow everything till the end. That is the crux what I'm telling you. Because if suppose you catch a thread here, catch a thread there, this is called as MCQ based learning, which half of the doctors of this country are actually doing. And that doesn't make you a good doctor. That may give you a very good college, that may give you a very good rank, but you're not here to become good rankers, you're here to become good doctors. And that is what strictly at Dr. Polaris we are also following. We are not here to promote that culture of MCQ based learning. No. We are catching you right from your first year journey till your final year, hand by hand, holding and mentoring you till the time you understand that why I actually read that thing and how am I actually applying it. And we have got these kind of scenarios in our app too. We have given you those integrations. We have given you those kind of logical thinking where we create scenarios for you and you finally tend to understand that, oh, okay, this patient will look like this. This patient has that kind of a symptom that matches something that I read in physiology. That is how we make you learn. Now here only, I'll just come and touch on the concept of horizontal integration and vertical integration, where early clinical exposure is very important. So what exactly is horizontal integration? It's very, very simple. If suppose I'm having a topic of neuro in my anatomy, so neuroanatomy is my topic, I'll read the same topic in neurophysiology, where I will learn about that topic, how it is working. That means I have a horizontal link between what I read. in between the subjects of my first year. This is called as horizontal integration. Now, suppose you've learned about heart anatomy, you learned about heart physiology. And finally, you learned about lipid, where it comes into play because it is related to heart diseases. So you learned about the lipid metabolism in biochemistry. So it is a link. This is called as horizontal integration. And the second thing is vertical integration. Vertical integration means that suppose if you're learning upper limb chapter, let's say fracture, or let's say clavicle anatomy. So how does this apply? This will apply to orthopedics when you actually learn fracture of the clavicle. So you ended up right in final year, and that's how you integrated it. That's called as vertical integration. These are the two ways. So vertical integration and horizontal integration just follow the same rule, that they want to expose you to what all things can go wrong in different scenarios and different systems. Because I want to stimulate your mind in actually telling you why, suppose I'm seeing you, why am I seeing you? What can go wrong if I don't see you? Why, how exactly am I talking to you? How this coordination is happening so easily? You have to think about that. So that stimulation of thought is important here, right? So here I will put an end to it, and we will straight away go to Abanti for the question and answer.
Wow, that was really an insightful session, sir. And now that we have come to the end of the session, I would request our audience, if you have any questions, kindly raise your hand and we'll unmute you and you can ask any questions. So now the stage is yours. If you have any questions, anyone? Come on, you can ask questions. It was a really insightful one. I mean, I'm thinking if I should ask the question forward, but it's all up to y'all.
I think we'll get more clinical scenarios, and they'll actually get to learn through the app itself, because we will be getting a lot of real life scenarios to you. We'll be showing you actually what we have told, that it's not going to be just reading and reading and reading. We don't support that kind of a culture. That's why we really focus on the learning culture. And that learning culture is something that we created for you. So if suppose you're having a doubt, if suppose you're having any kind of an thinking that why this thing is happening, you'll definitely find that integrated topic next to it. If you're reading something, our app has been designed into that way that we have got the integrations also at that particular place. So you will be able to understand it more. That why particular, if I'm reading suppose the topic of anatomy, you have your corresponding integration mentioned there itself. So this is how the app is also being designed. So that is what Polaris also holds, and we expect all our viewers as well as all our students to follow the same logic. Don't become just good rankers, become great doctors, because it's a huge journey. You're stepping into the first stone of your life, and this is not going to stop. You are going to learn till your grave. So once you are going that step by step, make the most out of it. And we are there to hold your hand. We are there to help you out at any particular point, at any particular cost, as whatever you want, we are there for you. Right? So I think it was really a nice session to get in touch with you and to get you through this journey of what we had, as well as what you guys are having and how it will be. So catch you later in another session. Okay, I think
we have a hands raised. Yeah.
Right.
Yeah.
Hello, sir. It's Aman Siddiqui.
Yeah. Hi.
Hi, sir. So, sir, I am a second year student.
Great.
Yes, I am FMG student, sir.
Right.
Okay. So, sir, actually, I'm new on the Polaris. So, I want to learn. I don't know. Like, I was installed last day this app.
Right.
So, I want to know about it. How I can access it. How should I access it? But I want to know about this tab. How I can learn from this app.
See, what I can tell you is, first of all, that once you have logged into the app, we have got all the subjects over on the app with their particular topics, whatever has been given to you, right? There, whatever you want to read, you can straight away go to that subject,
okay,
and you will have those particular systems that will be given to you there. So if you suppose open anatomy, you will be given all the systems of anatomy. Whatever you want to read, go straight away on that system and you will be given that topic. Then you can choose your topic and you can have your happy learning. For FMG students particularly, we are having a separate session.
Okay.
So we are opening this ground to foreign medical graduates, how the learning has to happen. And we'll take you through that tour.
Okay.
Right from your first year till your final year as to how this learning will be.
Okay.
So I think you have a great amount of things waiting for you, because the next thing that I'm going to implement here, or what I'm going to talk about, will be foreign medical graduate learning very soon. Okay. So I'm going to tell you about it. Till then, you can surf over on the app.
Okay.
And second year, definitely, what you are currently reading? You tell me that.
Actually, sir, as in second year, now our microbiology is over. In second year, they start from the first semester, first year at the last next sem. In the second sem, start the microbiology, and it's run for the second year to last semester. Second year, it take 3 sem for the microbiology. Okay.
Okay. Correct. Yeah.
And I had completed my physiology also. And anatomy also, it's completed. Now it's starting the clinical anatomy. It's going on.
Right. So that is why. And which college are you from, if I'm not wrong?
Sir, I'm doing from the Ukraine. That is Uzhhorod National University.
Great. Great.
Okay. Now it's sir. Now I'm in India because of the war situation going on over here.
Right.
Over there.
Right.
So that's why I'm in India. I was request to the Polaris at before. I already connect with there on by DM on Instagram. So actually, I'm right now in India, so I'm thinking about to do some observership over in right now. Like, want to learn some senior doctors.
Okay, so I'll tell you one thing. Observership, you said it brilliantly, right? Because when you see certain things, you remember very well. Right?
Yes, sir, exactly.
Correct. And when suppose if I am a student, right, I still do my observership on YouTube. If I'm not wrong, I seriously, when I do a surgery today, I seriously go to a channel, I see that surgery, and then I operate, because I have to, remember those things.
Yeah.
So this is why we have designed this app in such a way, so that your observership not only theoretically but also clinically happens through the app.
Okay.
So you're just not oriented to the theoretical point of view. We will teach you that everybody teaches you. You will have your textbook everywhere. The content is going to be the same. It's not going to change. But what makes it different? The difference is that we want to show you what actually things are happening, why it is happening. And that is what we have adhered to. So for foreign medical graduates, definitely there is a segment that is coming up very soon. And all your topics of all the years are available on the app. Your content is not going to change for a foreign medical. See, foreign medical education, there might be a kind of a change in the schedule that you have.
Yeah.
But the content is going to be the same, right?
Yeah.
If there is heart, nothing is going to change the heart. So all of these things you can easily go through the app. You'll find all your topics. You can find all the integrations also there. So suppose you're reading something, you'll find the corresponding integration of that particular topic of final year there itself. And that will help you to understand why that particular thing happened.
Okay, fine. Sir, in future, you have heard about it. It's in future, maybe in 2026 or 2025. The next was implemented in the India. Next exam. That will be step 1 and step 2.
Yeah, still that is going on. Still it is not being out. They have proposed the next schedule.
Now it's planning to, they are planning right now.
Right. So they have planned, they have given the curriculum of next, but they have still not taken out the exact norms of how the exams will be conducted, where it will be conducted, and how will it be for the foreign medical graduates. So they have not made it very clear. But definitely they are going to state it up soon. And we are going to tell you the moment we get to know it.
Okay. Sir, I want to know that if right now the syllabus was in the app right now, they contain this on the app right now. So is it sufficient to me if I learn from that only?
Okay. So I'll tell you one thing. Okay.
Yeah.
Data is more than sufficient. Okay. It's more than sufficient. There are 10,000. See what we have done If suppose you take my subject, ENT, okay, I have taken out the crux of almost 1920 textbooks and given it to you there. So you
Oh,
don't need to go into any other thing.
okay.
That's what we have done. All our educators, because that is what educating is all about. We have taken the crux of all the important things and give it to you in a simple format in 45 minutes. That's what an educator
Yeah,
does, right?
that's what I wanted, sir. Because if we run to many multiple apps, applications to see search the main content, it's burst like it many burden in created. Like we have to see a 16 hours of video, 12 hours of video to clear the one concept.
Right,
So,
correct.
so,
So that's what I'm
so
saying. We are not
we
here
are
to confuse
searching that
you.
platform where we
I
can
have been,
minimize the things in one single video in such
yeah.
a short period of time, because already we have very maximum syllabus, so
That's what
it's
I'm
very.
saying. See, I'll tell you one thing. Keeping things simple will always help you. And when we were creating this app, we made things as simple as possible because we have been on the same seat as you are. We
Yeah,
have also
exactly.
gone through the same phase when we were reading. So I
Yeah,
also
sir,
wanted,
obviously.
that someone teaches me. Unfortunately, we never had that. We never had a mentor in our MBBS time like we are trying to implement today. Because that time there was no concept of tabs and phones, and we were not very technologically, we call it technologically handicapped, we were. But now through this portal, we are trying to communicate to as many students to teach them the correct ways of learning and to make them as simple as possible. Because if I'm learning a particular topic, it has to be very simple and it has to be logical in my mind.
Yeah.
I just can't read it and I can't and keep it in my mind. Tomorrow I give an exam and then day after tomorrow I forget. It won't make me a good doctor, right?
Yeah,
That is what we have given it to you, and that is what I want to instill. And I'm really happy that you asked me that question. That what exactly how we have created it and why this has been created. It has been created for you, and it has been created with a lot of effort just to make things simple for MBBS students. That is why we call it an MBBS learning app. It is not a NEET PG preparation portal. We will get a NEET PG segment which will be separate. That is for next. So we are
okay.
getting that is a separate segment. But our app has been designed for the framework for MBBS learning. How to make you a good doctor.
Yeah.
Right?
That's mattered. Because sir, we have to learn the skills. On that basis,
Absolutely, you
we
have to
give
learn these
our
skills.
best.
And
On that
that's
basis,
why
we
we are
give
here to
our
hold
best.
your hands.
Yeah. Sir, one more thing.
Yeah.
Actually, on right, like in foreign medical graduate students, till
Hmm.
third year,
Right.
we did not get much clinical exposure.
Correct.
So I try to learn random cases from the random cases from the
Correct.
Googles.
Hmm.
I search always different cases for cancers, for tuberculosis, different cases. That kind of a specific age patient he has, she has,
Right.
she has something that blah blah.
Hmm.
It very good. I learned many and almost something 600 cases I have already learned.
Great.
So in
Great.
many cases I learned many medications also, and
Hmm.
the pathology and the physiology, what is going on that patient, the faces and all. Even I try to learn the basics diseases also. Like
Hmm.
now how as like in India, as I told, I have seen many cases in India that
Hmm.
MBBS or BHMS, BMS doctor that have pursued, and they are practicing or serving to the nations. So
Hmm.
I see that they treating multiple diseases, different categories patient. Like
Hmm.
he's only BHMS or MBBS, but he is
Hmm.
giving a treatment to the dermatologist kind of
Hmm.
doctor. So
Hmm.
I learned many things cases. So I
Hmm.
tried many times clinically. Many
Hmm.
times clinically, I tried the medications,
Hmm.
and I got success multiple times by treating
Hmm.
that self by medication. But I don't take randomly doses. I take doses according to the pharmacology, like that weight a patient have. So we according to I have to choose that kind of doses. That
Right.
mg of doses I have to choose for that
Right.
patient. So I
Right.
tried multiple times. I get succeed many times. The patient cured by that self. So it is good, it is right to do that. I have that doubt.
Right from the beginning. That is why, I really congratulate you for that. I really congratulate for the efforts that you have made. I'm really happy to hear that. Because even after not having enough clinical exposure, you went ahead, tried your own ways to get that exposure, and that is great. because you're a hustler. You have hustled your way out. That is the first thing that you need to do in MBBS. You need to be a hustler. If I'm not getting this today, I have to keep hustling till I actually get it.
Yeah.
And you can't give it up. You can't give up on this because it is about a patient. You can't give up on a patient. You might be wrong, you might be right. That is a part and parcel of your, whole life. But
Yeah, sir. Actually,
you have to
I
try,
always
right?
trying to learn. I always try to learn
Correct.
because
That is the right thing. That is the right way. And I promise you, we are definitely getting clinicals very soon. Okay. So we are working on that and we are getting the clinical aspect very soon over on the app where you will get all your things out there at once. Where you will see, where you will exactly know why everything is happening. And especially for foreign medical graduates, we have a separate segment. So don't worry, we have a separate segment for you too. Okay.
Yeah.
And there is nothing as, a different syllabus for a foreign medical graduate or an Indian medical graduate, or
So, sir,
you're not under
almost
the
it's same. Almost
same.
it's same. I had compared to the Indian
It's
graduate
not
students.
almost, it is the same. It is the same.
Yeah,
Human body
sir.
will remain the same. Treatments will remain the same.
Even
Nothing is going to change.
even foreign medical graduates now, sir, even they study more subjects, even like philosophy and blah blah whatever. It's very
That
heavy
is
to
what
us.
CBME also has given. The third element of CBME is philosophy. It is
Yeah,
about literature. It is about humanity, understanding the humanitarian grounds.
yeah.
And I'm really happy that you're putting so many efforts to that. Right?
Actually, sir,
So,
in India,
yeah.
they teach only 3 subjects for the first year students.
Hmm.
That is biochemistry and that anatomy and that is physiology,
Right.
maybe microbiology. So these 3 subjects, and in foreign medical graduates, we have
It's
now
different.
11 to 12 subjects.
I know. It's different. Because in foreign medical graduate studies, you have what we call as lateral studies or horizontal studies.
Yeah,
They have a lot of subjects that you study: anatomy, physiology, biochemistry, microbiology, pathology, everything together. And
yeah,
then that is carried over on the second year as well.
yeah,
So that is something that is also a way of integrating things. So
yeah,
foreign medical graduate students also have a kind of different kind of an integration.
yeah,
So, but still the crux remains the same. Even if you are learning that in first year or second year, the crux is going to be the same, because you have to finally learn all the subjects, all the chapters, and by the end of the day, you need to apply that over a patient. Correct?
okay.
Right? So
Yeah,
nothing
yeah,
is going to change. Your syllabus is going to be the same. It's just how different ways you read.
yeah,
Right?
sir.
Nothing else. And that may burden you a little bit of time, but that is the whole crux is going to be the same. You have to finally treat that patient. How will you treat it? Correct?
Yeah, sir.
So we have got everything for you. Don't worry, first of all. And I promise you that we are there to support you in throughout your journey till you become a great doctor. So we'll stay till the end, till you become a great doctor, and then you call us once to tell us that you have been a successful surgeon, and
Oh,
we'll be very happy to hear that.
yeah, sir. I will. Sure, I will.
Okay?
Yeah, sir.
Great to hear.
Thank you so much. Thank you so much, sir.
All the very best. Abanti, any other questions?
I don't think so. We do not have any more, but I think it was very insightful for everyone, whoever listened to the queries that Aman has put forward. And I think we can go forward and conclude the session.
Right. Thank you so much for having me tonight, and all the very best to everyone.
Thank you so much, sir, for giving such an insightful session to all. I hope everyone enjoyed, and we'll see again each other next Wednesday, 8 p.m. Thank you.
Surely. Thank you. Good night.